So we go to the second talk of the day, which is on case presentation, and we have taken 5 cases which should be helpful to us to understand the methodology of treatment on the basis of psychiatry and also the miasmology. Now, these cases, as you can see, have been taken up from Homoeo Mirror student section, and the series ran continuously for quite some time, and we presented about 50 cases. And the old editions, if you can lay hand to, you'll find some good interesting material there. So from there, these 5 cases have been taken, where we used to put every case every month and put some questions to it. And from our readers, the answers were received and were published in the next issue. So that we are going to use here. An allopathic practitioner was very much disturbed with the sickness of his mother. The lady was suffering from continuous fever for more than 15 days. Now, first of all, the doctor thought it to be an ordinary catarrhal fever sardi, but gradually the case took a serious turn. For last 2 to 3 days, the lady was in a state of deep stupor. She had stopped talking. She did not even ask for water. Rattling sound of respiration was not so much audible by that time. She was also evacuating involuntarily, passing urine and stool in bed. Sometimes she was muttering, which was difficult to understand what she is talking about. Very often, she would uncover everything, complaining of a hot feeling, as it was understood, the covers, even the clothes for that matter. Failing to obtain satisfactory results by his best possible efforts, consulting even his colleagues and seniors, he then thought of seeking help from a homeopath or local resident. When homeopath entered the room, it was a shock to him. 80 years old lady, so thin in her skin and bones, was lying in bed unclothed with half closed eyes. The doctor had already learned the history. Now he opened his medicine chest, asked for a cup of water, dropped 1 drop of remedy into it, and advised to administer 2 teaspoonfuls after every 4th hour. It was really a surprise. The patient was cured very soon. Temperature subsided the next day. Now, which drug was administered? Can you afford an explanation of cure? Yes, you are right. Curative drug was Hyoscyamus 200. Desire to uncover in a typhoid state is so much striking that individuality was instantly discovered by the patient, by the physician. In acute cases, vital principle shows conspicuous, there is clear indications towards a drug whose unquestionable curability is always explained by law of similia and by the results which we obtain. We have to be in look. We have to be in attentiveness. Senior homeopaths of our time would attend the acute patients. Even it was told about Dr. Kanjilal, Dr. S.P. They would go to the bedside of the patient, would sit there for minutes and hours, take tea, have discussions, observe the patient, and as soon as the prescription was made, Kanjilal will stand up and say, "All right, I'll go. Give this medicine." Dr. S.P. his cases also, we have heard that they will sit by the bedside till such time that the individualizing feature is not recorded. Individualizing features are not so readily accessible, but not such which cannot be found. That is why Gellert's poem has been quoted by Henneman. The truth we mortals need, us blessed to make and keep, the all-wise slightly covered over, but did not bury deep. That means the truth is visible. It is hidden, but not so much hidden that you cannot find. But you have to find, make efforts. So that is what this case like this teaches us. Next case is suffering from this SK 49 years old male suffering from persistent inactivity and insomnia. Basically jovial and active. He started growing lethargic for nearly a month, but he complained to none. His wife noted it first. She was undergoing homeopathic treatment for some of her ailments. But she failed to persuade him, the patient, to attend the clinic of her physician or to receive any curative medicine. That shows that there was lack of insight. Hence, she herself was eager to get some drugs for him. She requested her physician, but she was refused because it is always a bad practice to give some drugs for a patient whom the physician fails to see, attend. So he was not willing to come. The only option left was that she started requesting physician to visit her residence at least once. Finally, the visit took place, and the symptoms which were often are recorded. Unreasonably lethargic for 1 month. This is going to happen in mental cases, Mental cases are not going to come to your clinic and start telling you all symptoms and prescribe. The situation will be like this. That is why this background is very useful for understanding. Unreasonably lack of activity, lethargy, dullness, growing fatigued easily, growing indecisive, cannot stop thinking. Always brooding over something. Indifference to everything. But previously, it was opposite. It was not like that. Forgetful. Though in past, memory was sound. Anxious and nervous regarding especially trifling matters. Though previously he was just the reverse. Taciturn. You keep shut. You do not talk. Though previously he was loud, garrulous, talkative. No sex desire for past 1 month, sleeplessness, fears the heat of sun, though earlier he could tolerate it well. Past history of reserved displeasure, recent and remote, history of amoebic dysentery, every rainy season, and melena in 1957, which was induced by the drugs for amoebiasis. Rather, he was chilly earlier, but now intolerant to summer. In general, it is varied, appetite remarkably poor. Recently, craves sour, salt, bitter, fried food, mild warm dishes. An aversion to aubergine, which is brinjal, pumpkin, thirst scanty, sweat is plus during sleep or working hours. No stain or smell or reaction to sweet. Sleep, very scanty now. Sweats during sleep, saliva plus. Mind fond of reading books, never extravagant. It is miser. Then tongue moist and clean. The drug given was natrum carb 200. After which we find the report after a week, more active, sleeping well, placebo he was kept on. After a fortnight, acidity occasionally, activity is okay. Acidity giving trouble. So symptoms were surfacing. So natrum carb was repeated in 1M potency. Acidity again, no relief. Sleeplessness of late. So sepia 1M was given. Better. Allergic skin ailments for 2 to 3 days, cause unknown. Placebo. Allergy not responding. Not feeling fit from all sides. Improvement not taking up more. Soranum 1M. No problem. Placebo. Now, what is your nosological diagnosis? Here, the nosological diagnosis is a case of depression. On what ground was natron carb selected? The answer to this is, apart from features of depression, patient's reaction to samar, then soric state, an entire totality that goes in favor of natrum car, the drug picture. Why was CPR administered? Condition indicated necessity of a drug which is complementary to natrum car. Because Hahnemann has said a series of remedies are to be given, a series of antisorics are to be given. Not a single remedy will cure everything. This is what is wrong teaching of which we have received. So the next medicine required was complementary. Among complementary drugs, CPA was selected because it covered at same time psoric sting and all symptoms presented. Also, mental feature that he was never extravagant went in favor of CPA. How do we justify selection of Sorainum? Now, Sorainum is one of the deepest antisorics. It covered totality of symptoms and it also features of depression and allergy. It also complemented CPR at the same time, hence it was selected. Now the next case. Case B, aged 55. Possibly no pen could draw or show face of this senior insurance executive when he came to my clinic on 12 February 2000. This is a case of my Chinwara peripheral training, which I used to visit every fortnight. So much fear and anxiety, so much distress and disturbed look was there on his face. Very much depressed person. The complaints which he described: heaviness in forehead during driving. He started feeling for more than 2 months. Before 2 months, he was not having this. He needed a help to accompany him, escort, wherever and whenever he would go. His gait was also remarkably trembling. Episodic bouts of depression. He had depression earlier also, and he would get attacks of depression. Clinical findings: pulse normal, small calculi in right kidney for last 1 year on sonography. X-ray showed degenerative changes. Then blood pressure within normal limits with allopathic drugs received daily. In past history, renal calculi in 1994 also. Then addiction to tobacco and alcohol now given up. Family history of depression. Generalities: chili patient, craves cold dishes, likes sweet and spicy food. Then mood changeable, memory not dependable. First prescription and follow-up we find I gave Sorainum 1 potency only 2 doses. After a fortnight, when he came to my clinic, I was astonished to see a normal looking cheerful person sitting before me. So much change in face within a fortnight was very noticeable. Absolutely no depression, no driving problem. He did not bring anybody. He came driving himself. No tremulous gait. Placebo he was put on. Treatment was discontinued. He never came for his complaint, but he kept on sending patients to me. Now give an anamnesis of the case. Depression is generally psoric. It may be syphilitic, but juxtaposition of anxiety and distress point out to psoric preponderance. His chilliness, changeable mood, etc. are also psoric features. Cravings also show combined features of psora and syphilis. Now justify the selection of Sorainum. Case representing predominance of psora needed an antisoric to cover basic as well as general features of case, hence Sorainum was selected. What other remedies patient may require afterwards? It is a different thing. Patient did not come, but for the sake of completing, had he come up, or in such cases, what medicines would be needed further? Patient may afterwards require medorinum, meselium, leccaninum, silicea, etc. Comment on potency selection. Sorainum was allowed to remove psoric block as also to cover mental features. For both reasons, repetition is not desirable. Hence, centesimal potency was given and 50 millisieverts potency was not given. Susceptibility was not at all low. That is why he was given 1 evidence. We go to our next patient. That is XYZ, young, aged 35 years. On 14 January 1999, a widow who was 70 years came to clinic of a homeopath for treatment of her son. It was her fourth son, a young man of 35. He was showing features of psychic abnormality or aberration. As a local resident, the fellow was not unknown to the physician. He was known to the physician. For several years, he had been observing this weak and unobstructive fellow, not disturbing others, selling beetles, pan, betel nuts, supari, cigarette, etc., sitting in a small shop at corner of market. An ordinary person. Compared to persons of his age group, he was not very much intelligent and sharp all along. He would talk less and was probably bashful, that is, shy. No one, however, had any problem with him. Problem started after his younger brother's marriage. His younger brother got married 6 months back. Now that surfaced the problem. For several months, mother said some urchins, that is bad elements in neighborhood, used to make fun, delight in passing comments by playing pranks with him, cracking jokes with him. This time, instead of passing some bad, vitriolic or caustic comments, they started making an artificial friendship with him, feigning friendship with him, and they provoked, and he was convinced that his mother and brothers were not arranging his marriage. So what they did, they made friend with him, they insinuated him, irritated him, and wanted to make fun of him. So not arranging his marriage intentionally, though it was true that his earning was something substantial to family. This boy was making good earning. So in spite of making good earning, they are not arranging marriage. So this added as an exciting factor. The mother said change in his attitude and behavior she started observing conspicuously prominently for last 3 to 4 months. He became garrulous. He became over talkative. He became overactive. He even started being aggressive, alleging that they were ignoring him to family members. Often he was eager to prove that he was not so much dull as they were considering him. For nights, one after another, he remained sleepless. His sleep was lost. He needed no rest in daytime also. In daytime also, he was not at all feeling sleepy. Often he would wake up from sleep at midnight. Even when he is lying down, from there he would wake up in middle of night and would go out for a stroll, walking, and returning at dawn, returning at early morning. He could not concentrate on account of his shop. That is the accounts, the money matter also he could not concentrate. He even exhibited gross negligence to attend shop, which once he considered as everything, that is his business. He was not at all concentrating. He became emaciated. That also emaciation was remarkable. But he refused the mother's advice to call for a doctor. So here no insight. Because he said he was alright. Now mother said she could furnish some more symptoms, but she must need a remedy. The mother requested she needs a remedy. His unkempt appearance, that is shabby appearance, is unbearable to her. Moreover, medicine should be something which she could dissolve in his drinking water, which she must not be able to smell out. He must not be able to smell out. So that means the medicine should be given, otherwise he has no insight, he will not take the medicine. No physician can honor conditions as such. But it is very difficult to ignore everything but But it is difficult to ignore a weeping mother. On inquiry, it was known that he was a hot patient with tendency to freeze sweating, but recently he was avoiding bath. Thirstless and constipated, he used to prefer mild warm dishes, sour and bitter food, milk and fat. In past, he had a history of prolonged suffering from convulsion with temperature. When he convalesced, he lost the ability to speak or walk. So there is a history. It took a long time to recover. Episodes of tonsillitis, infective hepatitis, severe injury in spine, bled once. Mother had and brother suffer from peptic ulcer syndrome. Father died of cancer. In paternal side, many family members, including his father, suffered from tuberculosis. He was administered platinum metallicum, followed by lysine and tuberculinum, all in 200 or 1 potency at suitable intervals. We are just giving a summary of this. From very first dose, he started showing improvement. His sleep, activity, behavior, emaciation, everything showed considerable change. Now his mother is working for a suitable bride. He rather is advising his mother to wait for a little more, because now his sole attention is to regain the lost glory of his business. He says, until or unless I can prove my credentials, who will be pleased to offer his daughter to me? That means his insight has returned behaving normal. What is your nosological assessment of the case? What is your diagnosis? Hypotonia. It was possibly a case of hypotonia. Give reasons behind selection of platinum, lysine and tuberculinum. We have these reasons here. A meek and humble fellow becomes arrogant. That is the drug, no? An arrogant person will remain arrogant. But here the drug speaks when the symptoms appear as a result of the disease. Increased libido was the reason. This was the keynote behind selection of platinum. Though the miasmatic aspect has also some other symptoms from generalities corroborated nonetheless. Lysine was selected as a drug complementary to platinum. Most general features were also nicely covered by lysine. History of past ailments also is a clue. To be precise, lysine being product of convulsive disease condition arising of a neurotropic infection, that is the hydrophobia. It is very often seen to remove after effects of many convulsive disorders, because he had a history of convulsions originating especially from an infection. Hence, it was administered. Family history is definitely a strong feature behind selection of tuberculinum. Even then, one must not forget this very point that mania has an intimate relation with tuberculosis. This point should be remembered. Comment on selection mechanism. For psychiatric ailments, repetition should always be done very cautiously. It is one of the main reasons why 50 millisimal potency is less advisable in these cases, because of repetition. Mental diseases do not bear repetition well. Last case. This tall and stout lady came on 19th April with her husband. She was complaining of profound weakness along with some abdominal discomfort after taking meal. She had been suffering from recurrent vomiting at the gap of 7 to 10 days. At all times, vomiting was so much severe and uncontrollable that she had to be hospitalized. The vomiting was always projectile with no trace of nausea. On last two occasions, there were loose motions along with vomiting. On those occasions, there was also history of taking rich and indigestible food materials. But on earlier occasions, there was no such history. She was thoroughly investigated. Hemoglobin less, ECG, etc. normal, ultrasonography revealed multiple uterine fibroids, stool examination for routine tests, etc. etc. nothing abnormal. T3, TFT within normal limits, blood group, routine, urine, etc. normal, chest X-ray, slightly enlarged heart, urea, creatinine were also within normal limits, endoscopy, gastroscopy also suggested that, but because of excessive expenses, etc., she did not go for it. Despite vigorous treatment, as such, for several months, recurrence could not be checked, so they decided to try homeopathy. Normally, it happens. On inquiry, it was revealed that for nearly 6 months, patient could not escape in taking sleeping pills. She was taking sleeping pills because she could not sleep after 3 a.m. But there was no tangible reason behind this sleeplessness. From history, it was also known that she lost some near and dear ones recently. Her spouse was a billionaire, though recently there was a slight economical distress, but still the respectable personality and relation with spouse was an example to many local people. So they had ideal relationship. She was reserved, natured but intelligent. She had profuse thirst and good appetite. Tongue was clear and semi-moist. Pulse rate and BP were also normal. She was administered arsenic album 200, which ameliorated her promptly. It was raised up to 10 m potency at suitable intervals, but there was no vomiting since the very first dose. Slight sleep problems, she kept on complaining still now. What is your nosological diagnosis? With all probabilities, this also was a case of reflux. Why was arsenic selected? Apart from vomiting episodes, she had enough of weakness and abdominal discomfort after meal. Depression developed from death of near and dear one, and from financial loss of husband was obvious from her reserved nature, psychogenic vomiting, sleeplessness, and waking at 3 a.m. All these features are strongly in favor of arsenic, which is thirsty, no less. Coming to her potency selection. After enormous drugging, 6 or 30 potency would possibly take longer time to show response. Susceptibility of patient was not so much high as to require potencies like 1 m, 10 m, etc. So 200 potency is safest. What may be your second prescription? Covering presenting symptoms as also uterine fibroid. Second prescription may ask for Fuja, which is a drug complementary to arsenic. So if there are any questions, we can go ahead further.